By the end of this lesson, you will be able to describe Maslow's theory of needs. To provide the best communication with our clients, it's helpful to understand why people behave the way they do. One psychologist, Abraham Maslow, developed a theory to help answer the question, why do people behave the way they do? Maslow's theory describes the behavior of people as they cope with the world and they work towards happiness. Maslow believed that our human needs can be divided into 8 levels. The lowest level needs need to be satisfied before we can move up to the next level. So for example, a person's physical needs need to be met before they will consider their safety needs. And their safety needs need to be met before they can think about their love and belonging needs. So for example, a person who does not have food to eat may not care about talking about their medications to keep them healthy because their first priority is getting food in their bellies. Once their physical needs are met, then they can start working on their health needs. Now, therapeutic communication is a process of communicating with patients and family members in healthcare. It encourages healthcare professionals to build a rapport or relationship with their patients and takes into consideration all of the factors that we previously discussed, such as diversity, professionalism, respect, boundaries, needs, etc. Active listening is the most important aspect of therapeutic communication. Active listening means that we fully focus on the communication, what is being said, and how it is being said. When communicating with patients, it's helpful to use a combination of open and closed statements or questions. Open questions ask for general information, and they encourage our patients to respond in a manner in which they feel comfortable. For example, how are you feeling today? Is an open-ended question. It allows the patient to just express how they're feeling in as many words as they need. Closed questions ask for specific information, so they limit the patient's answer to 1 or 2 words. These type of questions are really good if we just want to get some facts. For example, what is your date of birth? Now, depending on the situation and the information that you need to communicate with a client, you may use a variety of therapeutic communication techniques. Some of these techniques include reflection. So reflection is when we want to try to put a person's words into feelings. In other words, we're trying to clarify how they're actually feeling about a situation. For example, it sounds like you are feeling scared about your upcoming surgery. This then allows the person to clarify, yes, I am feeling scared, no, I'm not, and takes the conversation further. The technique of restatement or paraphrasing is one in which we rephrase what the person has said to make sure we fully understand what they're telling us. Now, you don't repeat their exact words back to them, but you rephrase what they've said. Here's an example. So, it sounds to me like you're saying that your pain began after you ate your dinner. And then the person can say, yes, or no, not quite, and clarify further. The last technique I'm going to discuss is called clarification. And clarification is asking questions to get more information. So, similar to before, instead of rephrasing, You could say, "Can you clarify exactly when you started to feel the pain for me?" And let them put in their words exactly when the pain had started. To wrap it up, we want to create a professional relationship with our patients. Make the patient feel respected, involved, and knowledgeable about their plan of care. By using therapeutic communication techniques, we can build that respectful, comfortable, and accepting relationship with a patient and assist them in meeting their needs.